improving, but the rate of improvement, it'll take us about 2 years to get 100% there. So you can see those percentages. We're going up about 6 to 8% a month in a lot of those counties, which is good, but it may not be enough, fast enough. And so I'm going to hand it off to my colleague Steve, and I'll come back and close it out. Steve's going to really show you a lot of work that he's been doing to actually make the data about vaccinations at a community level accessible. Take it away, Steve.
Hello, everyone. I'm Steve Saylor. I'm a software developer at the Western PA Regional Data Center. And here I just want to go through some of this map we put together with the BEC that shows by zip code the Black vaccination rate across the Commonwealth. You'll see a few holes here, and I'll explain some of the missing zip codes in a second. And I'll have a QR code later on that I'll stop on for people to get a link to after we go through some of the slides. So before I do that, I'm going to real quick just go through some of the highlighted counties. So the first, we start with Allegheny County here, and as Bob had mentioned about the range, here you can see actually see the numbers across the top 10 selected zip codes by, we selected the 10 zip codes with the highest proportion of Black population in Allegheny County. And then in Dauphin, we went with 5 in Dauphin and Erie. So you can see here, and like Bob mentioned, the range between 30 and about 50. And then in Erie, same, we have around 30, a little less than 30, up to about 50 is the range. So now that you've seen that, I'm going to leave this QR code up for anybody real quick to send a link to the map. And then as you're looking at that, you can go through the data sources. So the first part of this is the COVID-19 vaccination data provided by the Commonwealth on their open data portal. So what we do is we take that and we combine it over top of the Black population and total population from the American Community Survey. Now, one thing to note is that these population numbers are just estimates. They're developed through a survey, and then statisticians try and estimate population numbers. So what will happen is you'll have places where the vaccination rate or the number of folks vaccinated might be higher than the population estimate. And so that's where you'll see on the map, when you look at it, there are some zip codes that have greater than 100%, and that's because of just inaccuracies that we have to deal with in the estimates. In some really less populated zip codes, the difference was so extreme that we just removed them from the map because that they would have given the wrong impression, because it was mainly an effect from the lack of good data of population data. So another thing to notice, pay attention to, is that about 10% of the vaccine records have unknown categorized as race. So this is in cases where someone either chose not to enter their race or provide their race, or it wasn't an option available to select at that time. And so it's important to know that that number comprises some set of people across different races, and so the actual Black vaccination rate does not include people who may have who may identify as Black usually, but didn't have an opportunity or decided not to in this instance. About 10% of people fully vaccinated reported more than one race, and this we noticed compared to less than the 3% that we usually know. So there's some selection difference in how just how people are reporting race between these two different instruments. And then, matching the second doses to folks is a challenge, and so we might not always have perfect numbers of fully vaccinated. And then also, Philadelphia manages their own vaccine data, and so the city of Philly should be used for the source of that data. So with those limitations in mind, we decided to put a few recommendations for ways to communicate this data. The first two are about the data themselves. So, as I spent a lot of time going on about, treat the totals as approximate, especially at these zip codes. There's just a lot of, messiness with the data. Let people know about the data context and limitations. So the data by itself can be worthless or maybe even dangerous unless you provide some context and explain, maybe why people might see numbers greater than 100% and stuff like that. And then the last two are more human focused. So, use empathy when talking about vaccine hesitancy. So, a lot of this is just numbers, but, there's folks involved. And to remember that, a lot of this hesitancy is, rooted in distrust of institutions and not necessarily an issue with science or vaccines themselves. And then remember that access to vaccine has not been equitable. And so these are the type of factors that can lead to, differences in the data between populations. And then we have some suggestions for using the data. So one good place to start is just to bring it as a way to kind of start a conversation and talk about it. You can also, this data is good enough to track the kind of progress over time because the limitations I mentioned stayed the same. So you can look at a zip code and see how it's doing next week, and it that gives you kind of an idea that you get a good idea of whether it's progressing there in the zip code. Target outreach and vaccination events. So if you're looking for places to have vaccination events, you might find, if two zip codes next to each other and maybe one has, a lower rate, it might be a better idea. It might be more worthwhile to go there. It's part of the decision. And then look for bright spots. So instead of just talking about numbers on a negative side, also talk about positive events, like find zip codes that have high numbers, or look for maybe find ways to tie into a story where like a vaccine event may have happened and a zip code has changed, and use those as kind of a way to use the data to tell stories of how that works in the world. And then, we have a whole bunch of different data sources here. So for when you have the slides, you can go through all of these, and that's it. I don't know if you need to do anything, Bob.
Yeah, I just wanted to say that if you need help with data, we're here with the Western Pennsylvania Regional Data Center. You can send us an email. We hold office hours most Fridays. You can drop in on those virtually. And you can find that link on our events calendar on our website. So I just want to say thanks for coming to town, and we'll see y'all soon. Take care.
First, thank you again to Bob and Steve. Again, our data group is extremely important across the entire BEC. Very early on in our process, one of the things that we noticed was that a lot of the data that was coming from both the state level and the local level was not disaggregated. And so it was very hard to determine any information by race. And our data team came together and really pressed upon that, working with the local health department, the state health department, to make sure that information was disaggregated. So when you hear information like 65% of Allegheny County has been vaccinated, that's great. But when you start breaking that down by race, you really get to the truth and understand that the black population is really under-vaccinated at this point in time. So our data group is extremely important to the work of our coalition. At this time, as Fred said at the beginning,